Principal Director, Director of Health and Family Welfare.
The objective of coming out with a report on the study was to find out the cancer profile in the state, focusing at the high incidence cancer sites and to identify the causes. The findings from the survey will form a baseline to improve and augment the policy and program with regard to prevention and treatment of
Recording in progress.
cancer. Cancer incidence, as we all know, will not decrease in future unless we focus to reduce the risk factors by seriously sensitizing the people and making them aware the kind of habits and lifestyle causing it, based on the survey made by the team. The government would like to extend sincere appreciation to both the Central Coordinating Agency as well as the State Coordinating Agency for taking all the pain, time and energy to complete the survey, which will go a long way in providing inputs to the policy makers, decision makers, implementers to know what is fueling the cancer burden in the state and adopt preventive and remedial measures accordingly. Thank you.
I take this opportunity to present to you all on the findings of the report on monitoring survey, cancer risk factors and health system response in Nagaland. The full report of which is going to be released very shortly by our Honorable Minister. Thank you, Minister, for sparing your valuable time to release the book. Before I start my presentation, first of all, I would like to thank NCDR ICMR Bangalore for their support, particularly Dr. Prashant Mathur, the Director, and Dr. Anita for her constant mentoring and supervision. I also would like to thank my co-investigator, Dr. Ebenezer Esau, and all the survey team members who have worked very hard in spite of the difficulties faced during the pandemic. So, according to our National Cancer Registry program, there has been a constant high incidence, mortality, cumulative risk of developing cancer in the northeast region of India. Cancer shares several common risk factors and establishing comparable health system needs with other significant non-communicable disease play an important role for prevention, early detection and control. The population-based cancer registry has provided much needed cancer data. It is vital to understand the likely reason for the reported cancer incidence and its outcomes to track, evaluate and implement suitable interventions. The targeted population before the survey was 18 years and above, and both rural and urban was taken. Data collection tools were included household, adult with cancer, and health facility, primary health center, CHCs, district hospitals, and private facilities. The survey was conducted between November 2019 and March 2021. Area covered is Kohima and Dimapur district.
I went for review programs 13 times, which means for 13 continuous years. I cannot begin to count how much help and support I received from all my dear and near ones. They prayed for me earnestly, gave moral and financial support generously, and also all kinds of support my family needed to cope with that situation at that time. Although there are many people to whom I want to thank personally, but I shall not go into detail today to save our time here. Most importantly, my doctor, late Dr. Katie Dinshaw, who was then the director of Tata Institute, who not only gave me the best treatment, but became a friend and a mentor. During my follow-up visits, she opened her home in Bombay for me to stay, and she even came to Kohima to see me. Later on, she took initiatives to create awareness and in setting up of cancer infrastructure developments and provide training to some of our doctors from the Northeast region. She was an exceptional visionary and a doctor whose life was cut short very sadly by cancer in 2011. During my treatment days, my daughter, Nitsa, she was always with me, and she maintains a daily diary. She notes down every day's events. And in one of her diary, I found she once wrote, I quote, "Cancer has the power to destroy all hopes, but it also has the power to shine the light on the true meaning and purpose of life."
Greetings from the ICMR National Center for Disease Informatics and Research in Bangalore. I am truly honored and privileged today to be amongst you, though online, to witness a very important event in which we are releasing the report of the monitoring survey of cancer risk factors and health systems preparedness in the state of Nagaland. This survey was done in all states of the Northeast in the existing population-based cancer registry areas to understand what is driving the cancer burden which is so high in the Northeast and including Nagaland. We heard about the high cancer burden. We heard about the lack of infrastructure, people spending so much of money seeking care, going outside the state, cancer being diagnosed at last stages, in advanced stages of disease, where treatment is complex, outcomes are poor, survival is very low. In terms of reaching out to people, and that in totality cancer is the 5th leading cause of death in the state. And very peculiar cancers occur which are not so high in burden in the rest of the country.
About 9 warning signals of the cancer to be circulated amongst the masses, and also we have to ensure the lifestyle modification which has been highlighted. Food is used as a source of welfare fire in 81% of cases. So I request the government of the Nagaland to implement universal Ujala scheme by providing LPG connection to each and every household to minimize the exposure of indoor pollution. Also, we have to see that salt-related, fermented food, smoked meat and fish consumption should be minimized. And also should be aware that there is cross-border
within launching program and report of the monitoring survey of cancer risk factors and health system response in our state of Nagaland. First of all, I want to acknowledge the work done by Dr. Kohima and her team for coming up with this detailed report on this subject. Despite the challenges faced, especially during the wake of the COVID-19 pandemic, your team have really done a great job for the people of state by overcoming the struggles with dedication and willing heart for people and bringing about real change for the Naga society as a whole. This study, I should see, is the first of its kind in Nagaland, which I believe will greatly enhance the understanding and our limitations in the fight against the burden of cancer, which has long plagued the population of Nagaland. It is a call for real, purposely, and transformative action that will improve the health and lives of patients and their families that have been traumatized by the burden of cancer, especially in our state for so many decades. It is also imperative to introduce a better healthcare service with focus on cancer and non-communicable disease in our state. Screening and early detection facilities should become a priority, which will directly improve the health status of our society.